Hi, you guys. Welcome back for our daily practice questions. It's day 18, but y'all know I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 58-year-old male presents to your clinic with complaints of difficulty reading small print and needing to hold reading materials at arm's length to see clearly. He mentions that his vision has gradually worsened over the last few months. On exam, his distant vision is 20/20, but near vision is blurry. What is the most likely diagnosis based on these findings? Is it A, myopia? Is it B, presbyopia? Is it C, cataract? Or is it D, diabetic retinopathy? Take a moment and tell me what you got in the comments, you guys. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, what is the most likely diagnosis based on these findings? And I tell y'all when we're being asked about a diagnosis, you need to run it back and look at those assessment findings, right? Assessment findings being their presentation. What are their signs and symptoms? What is the chief complaint? What is noted on exam? And then y'all know, I tell you, if they provide these three things, make sure you're paying attention to those: the age, the gender, and the ethnicity, okay? So here we have a 58-year-old male, came in, he's complaining of difficulty reading small print and needing to hold reading materials at arm's length to see it clearly. He mentioned some gradual vision changes that has worsened over the past few months, and his distant exams are showing that distance vision is showing 20/20 with the Snellen chart results, and the vision near their near vision is blurry. I don't know why I am butchering this. But again, the distant vision is 20/20, but the near vision is just blurry for this patient. And so, what is that most likely diagnosis? Y'all, this is classic presentation of presbyopia, right? Think about presbyopia when the patient is reading, just like if you hand them a flyer, a pamphlet, or anything, and they're needing to hold it back to see. That's that classic presentation here. So don't let all of the additional factors and details confuse you. Simply focus in on what they are truthfully saying here. And this patient has already came in. They're telling you that they have trouble with the small print. They're needing to hold things back to see it clearly. And then on exam, you also note that their near vision is blurry, right? So B, presbyopia. All right, question number two. A 45-year-old female comes in for an eye exam reporting difficulty reading small print and frequent headaches when doing close up work. She has no history of eye disease or systemic health issues. At what age group is it normal for presbyopia to begin developing? Is it A, 25 to 30 years? Is it B, 30 to 40 years? Is it C, 40 to 50 years? Or is it D, 50 to 60 years? Take a moment and tell me what you got in the comments, you guys. All right, so stem of the question here states, at what age group is it normal for presbyopia to begin developing? And again, this is a classic scenario of why the stem of the question is important, because here the stem is telling you exactly what you need to be answering on this question. So at what age group is it normal for presbyopia, right? So it is normal for presbyopia to be noted or to begin in around ages 40 to 50. So classic when you see it'll say like a 40-year-old patient is coming in for a routine exam And then they start to note like they're having to hold things away arm's length to be able to see clearly. So this is classic, and they call it that 40-year-old disease. So from 40 to 50, classic for presbyopia to begin. All right, you guys. And lastly, question number 3, a 52-year-old male presents with difficulty reading newspapers in small print, especially when using his phone. He has no significant medical history and his distant vision is normal. What is the most appropriate treatment to address his presbyopia? Is it A, reading glasses, B, intraocular lens surgery, C, corticosteroid eye drops, or D, referral to an ophthalmologist for laser treatment? Take a moment and tell me what you got. All right, so stem of the question here states, what is the most appropriate treatment to address his presbyopia? So what is treatment for presbyopia? And the best answer is A, reading glasses. Remember, again, that 40-year-old disease, if they're having this going on, the first line treatment or management is to start with reading glasses, okay? All right, you guys. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio, the number one at gmail.com. Everything that I offer is linked in the bio of this channel, including my website. And if you're looking to book any of my one-on-one sessions, any of the coaching, student coaching, tutoring, or custom packages or plans, I always say either call, text, or email, as I prefer to speak with you first to gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Make sure y'all meet me back here. Happy studying. Bye, y'all.